So before we get started, we want to thank you so much. We know this type of job is very demanding and it's a lot of work, and we want to thank you because without you, none of this would be possible. You guys are the forefront with our members, and we appreciate all that you do to help make a difference in their lives. So what's happening in the industry? We know that there have been many changes and continue to be many changes, and there's a lot of factors affecting those things. One of those factors is the fact that Medicare has received less payment, has provided less payments to the carriers for 2025. On average, more than 700 million to each carrier. And when this happens, obviously there needs to be changes in the benefits because we're working with less. Also, we've seen that there is the elimination of the coverage gap, also known as the donut hole. So that Inflation Reduction Act has capped out-of-pocket costs for Part D at $2,000. Also, we know we're dealing with inflation, so lots of external factors happening, but it's important when it comes to that elimination of the donut hole that our message to our members be simple. You'll want to let them know, hey, for 2025, you're not going to pay more than $2,000 in total Part D out-of-pocket expenses in 2025. And I'll go into a little more detail on that throughout the presentation. Also new for this year is Humana's all-new consumer plan priorities. So Humana this year got together with a research company, and they conducted a study of our members to see really what was important to them, what their needs, what their wants were. And with this information, we designed our plans to ensure that we were meeting those needs and trying to get as many of those wants met as well. With this information, Humana has created an online tool on our website, Ignite, to help you find the right plan for your member. I actually visited the tool yesterday to try it out myself. It's really cool. Basically, it helps you conduct a needs analysis. You can actually use it to answer questions while you're sitting with the prospect, but it'll help navigate the right questions to ask them to help select the right plans. In the product guide that you received after this presentation, you'll notice that each plan will have a consumer audience associated with that plan. So if you decide to use that needs analysis tool on our Ignite site, after you answer the questions, it's going to say, hey, you need to find a plan in that area that gives your member the most freedom and flexibility. And just to engage with the audience right now, if you see a plan that says, give me freedom and flexibility, what type of plan do you think we'd be looking at? Would anyone like to give a shot at responding to that one? Gives me freedom and flexibility. All right, I don't see anybody typing anything, but if we see that option, we're going to be looking at a PPO plan. If we're seeing something that says works with my Medicaid coverage, we're going to be looking at a D-SNP plan. So once again, a great tool available to you to help select the right plan for your member. What to know in your market. So the first set of plans we're going to be discussing today are our South Florida core plans. These plans are ideal for consumers who prioritize the most benefits and the best value. So the next three plans that we're going to be reviewing are specific to each market. We'll be starting off with the Humana Gold Plus 1036-065 core plan. And this plan services only Broward County. Some of the highlights of this plan: it's got a low MOOP of $1,250. Your PCP and specialist is going to be at $0, as well as your inpatient hospital. Your ER, you're looking at $110 copay. Your ambulance is going to be at $0. Across the board on all plans with all carriers, you're going to see this Part D MOOP capped at $2,000. Again, going back to that initial slide where we discussed that elimination of the donut hole. So you'll see this for every plan. Your retail cost sharing copays will be $0 for tiers 1 and 2, $5 for tier 3, 35% for tier 4, and 33% for tier 5. Our hearing vendor is True Hearing, and you will receive a $600 allowance per year for this benefit. Our vision, you will receive a $300 allowance or 2 pairs of select eyeglasses. And the vendor for that is Eye Care Health Solutions. The dental benefit for this plan is a $5,000 allowance. You can use this allowance for preventative dental services such as exams, routine cleanings, basic dental services such as fillings and extractions, and also major dental services such as scaling, crowns, dentures, root canals, and bridges. We do want to notate that there is only one plan in Broward County that has implants, and that plan will be discussed in the future. So just as a reminder, only one plan. This plan does not have implants. Also included in this plan, we have an OTC benefit. The benefit is a little bit different this year. So instead of using that mail order pharmacy CenterWell, there will be a prepaid Visa card that looks exactly like the one that you see here on the top right-hand side of your screen. This will provide $90 per quarter for your client to purchase over-the-counter health and wellness products at participating retail locations. This amount does roll over. You just need to make sure that your member uses it before the end of the year. So really excited about this benefit change for this year. It's something that our agents have been asking for, and we think it's going to be a real great benefit for them. Sorry about that. Okay, perfect. Also with this plan, you will get transportation provided through Motive Care. Our members will receive 50 one-way trips per year, or if they use this benefit for round trip visits to and from their PCP, it will be 25 round trip visits. On all our plans, you are going to see acupuncture as an added benefit this year of 25 visits per year. And also this plan does have personal home care. So this benefit assists people with activities of daily living, such as bathing, showering, and dressing. The benefit is for a minimum of 4 hours per day and has a maximum of 156 hours per year. To use this benefit, members, caregivers, or yourself can submit a referral by calling Helper Bees. The number is located there on your screen and will also be emailed to you. And Helper Bees will go ahead and take this information